This video will review how I read a CT of the abdomen and pelvis in the coronal plane. Radiologists primarily interpret CTs in the axial plane, but the coronal plane is also a great and valuable resource. It provides a more intuitive look at the patient as if you were looking at them. It is often more intuitive to referring providers and surgeons. It can help to develop a three-dimensional understanding of anatomy, as you see the anatomy in both axial and coronal planes. And it can also serve as an important safety net to identify key or critical findings that may be relatively easy to overlook on the axial images alone. So we'll start with the liver, as I usually just review the lower chest on the axial images. And we'll follow a similar search pattern as in the axial video, and so look at the liver morphology, the overall enhancement, and I'll look for any lesions. Next, we'll evaluate the biliary tree, and I'll start with the gallbladder. Here's a probable tiny stone or polyp. Here's the cystic duct, which will follow to the common bile duct, and we'll follow the common bile duct back to the central intrahepatic ducts here, and follow the common bile duct back down to the ampulla. And next we'll look at the pancreas here, starting with the uncinate process, pancreatic head, neck. Here's the pancreatic duct right here, and body and tail. Next I review the spleen, and I look at the splenic size, enhancement, and for any lesions. The left adrenal gland and the right adrenal gland. And now I review the kidneys, and I look at the renal size, the enhancement, I look for any masses, any stones or collecting system dilation. And I do the same thing on the left side. So here we can follow the portions of the ureters down to the bladder and to the ureterovesicular junction here on the right and on the left. Look at the bladder contour and enhancement or for any perivesicular stranding and any filling defects. And we can run the gastrointestinal tract now. So here's anal canal, anal rectum. Here's the rectum. Sigmoid colon, and we're going up here to the descending colon, splenic flexure, transverse colon, hepatic flexure, ascending colon, and cecum is here. And we always find the appendix. Here's the, or look for the appendix at least. Here is the appendiceal base, and follow the appendix out to the tip. Here's the expected location of the ileocecal valve and ileocecal junction. Here's the terminal ileum, and some of the distal ileum here. So now I'll look at the bowel antegrade, and here's the distal esophagus, gastroesophageal junction, gastric fundus, body, antrum, pylorus, duodenal bulb, and here's the second portion of the duodenum sweeping into the third portion, ligament of Treitz, and into the jejunum with this typical feathery fold pattern compared to the relatively smooth appearance of the ileum more distally. And the coronal really provides a great look at a large portion of the bowel at once. You can see we see this whole segment of small bowel, so I'll kind of run the left abdomen back and forth, in the middle, and then to the right. And that gets a really good global view of the whole small bowel caliber, any abnormal thickening or enhancement, or any masses. Looking at the rest of the peritoneal lining, I'll look for any free fluid, any peritoneal nodularity. We see portions of the greater and lesser omentum here. And now we can review the vasculature. So I start with the draining veins supplying the liver, so superior mesenteric vein, splenic vein, and then here's the inferior mesenteric vein joining the splenic vein. And these form the portosplenic confluence, supplying the portal vein and intrahepatic branches of the portal vein. Next is the arterial anatomy, descending thoracic aorta, abdominal aorta, celiac, splenic, left gastric common hepatic artery, and this first branch here is the gastroduodenal artery, and the proper hepatic artery branching into left and right branches here. Superior mesenteric artery and its branches, and finally the inferior mesenteric artery and its branches. And we have the common iliac arteries here after the aortic bifurcation, and the internal and external iliac arteries. So follow the right side down and the left side back up. So now we're ready to look for lymph nodes, and this provides a nice complementary view from the axial series. And so we have gastrohepatic ligament here, portohepatic lymph nodes and portocaval lymph nodes here. Peripancreatic lymph nodes would be in this location, and we can look at the retroperitoneal lymph nodes. So here would be celiac axis lymph nodes. Here are the celiac ganglia. It's more linear structure. And these small retroperitoneal lymph nodes. And also looking along the iliac chain and pelvic sidewall. We can follow the course of the vessel and look for any rounded structures next to them, which can oftentimes pop out a little bit more on the coronal images than on the axials. And the inguinal lymph nodes are here and here. And I run the left side back up. All right, so wrapping it up, we'll look at here's the patient's prostate and seminal vesicles. We can look at the muscular and soft tissue structures of the body wall and pelvis. And put on bone windows. Look at the pelvic bones, the proximal femora, hip joints, inferior and superior pubic rami with pubic bodies, iliac bones, sacroiliac joints, and the sacrum. And we get a good look at the spine and transverse processes. I go into more detail on how I look at the bones in all three planes in the series labeled Bone Run. And that concludes our video. Please check out the companion video that runs through the same search pattern in the axial plane, and also review the teaching cases in detail. Thank you.